join right here. So I collected a lot of questions yesterday from you guys, and we roughly divided them into a couple of different categories. Yes. So we're going to speak about different symptoms for babies and for adults. Yes. Wonderful. So I sent you a request. As soon as Priyanka is joining, we're going to start. Why don't you guys tell me right now, what is the most important symptom that you have in mind for our session? And in the same time, I'm going to be hiding our video from anyone here who doesn't want to discuss psychosomatics, but curious about ladies talking about something. I don't see Priyanka here. Dear Priyanka, are you here? Yes, she's here. Okay. Once more. One more time. Yes.
Hi, Kat.
Fantastic. Hey.
How are you?
Very good. How are you? Sound is
I'm
good.
also
I
good.
can see you very well. Thank you so much, Priyanka, Dr. Priyanka, for joining us. So once again,
Thank
I
you for
quickly
inviting
introduce
me.
you.
Yeah.
My pleasure. I mentioned to people that we work together in different capacities, sometimes in collaboration, sometimes you joined some of my programs as a curator, specifically relationship and love programs. And Priyanka is consulting psychiatrist and therapist. And I know that you're helping quite a lot of my clients whom I'm sending to you to discuss some of the deepest problems related to marriage and personal problems as well. And 17 years of experience, aims, Dr. Priyanka. So over to you, just quick introduction for our audience.
Okay. Hello, everybody. So I am Dr. Priyanka Yadav, and Kat has introduced me quite kindly. So I am a consultant psychiatrist and therapist, and I love to see individuals holistically. So I try to see them as a person with a body, mind, and soul. And that's what is depicted in my sessions. They are very personal and they are very individual. And that's why I think me and Kat gel well, because our frequencies match on that level, our works match on that level. So yes, I'm here in the capacity to help solve your problems, help spread more awareness, and that's what I do on Instagram. So
great, fantastic. So yes, we collected a lot of questions here, so let's not waste any time. Interestingly, let's start with kids, because people tend to see symptoms in kids first before they even recognize and acknowledge their own issues and their own anger. They come to me saying, kid is super angry, kid is throwing tantrums. And actually psychosomatics came to us because last week we had a discussion about the whole family system, that sometimes kids' anger shows not only psychological problem of the kid himself or herself, who is like 1 year old or 2 year old, but the whole family system. So from psychosomatical perspective, from medical perspective, anger specifically for kids or teenagers or children overall, what does it mean? What we should look for?
Right. So first, let's break down psychosomatics, since we are talking about psychosomatics. So it is psyche plus soma, right? So it is basically a body's way of showing any emotional distress. Any bodily symptom, any symptom in your body that is actually showing the underlying emotional distress is covered under psychosomatics. That's a broad term that we use. In our field, we use the term somatization for that, right? So that's the technical, but this is psychosomatics that we'll be discussing. So broadly, any symptom that you are experiencing or your kid is experiencing, and on evaluation, usually there is no bodily reason for it. So the investigations will come out clear. So mostly they are called as medically unexplained symptoms or psychosomatic symptoms. So coming to the question that you asked, Katrina, for the kids, I always say whenever clients bring their kids to me in therapies, I end up treating the family. and I
Yes.
don't even touch the kid, because in most cases you can say, or you can see, that the kid is actually a mirror for what's going on around him. So
Mhm.
kids are very good at mirroring. They can mirror what you are doing, and a lot of women specifically who have done my programs, they report that when we are working on ourselves, they are not working on the kid, but they can see that as they are becoming calmer, the kid is also getting calmer. You must have also seen this a lot in your programs, right, Kat? So when
Absolutely.
whatever we are feeling, the kids mimic those emotions. So if you want to see how you are feeling, see your kid. So if the kid is happy, engaging, exploring, curious, growing happily, that means you are feeling good. If the kid is cranky, in most cases, tantrums or meltdowns are a reflection of something wrong in the environment. And who is the immediate environment? You parents. We as a parent are the immediate environment. Right? So I recently talked about it in my free seminar also that I held recently. And it is that whenever I deal with tantrums or meltdowns, I don't like the word tantrums and meltdowns because we are negatively basically connoting
Yes.
their emotions. We all have tantrums, adult tantrums. So we don't call it tantrums, but yes, if kids are having a big reaction, a big feeling, then it's very important that you assess your own personality as a parent. So I do a personality assessment. There are a lot of things that may be wrong over there. I can give you an example, my own example. For example, uh, you know your personalities. If you don't, then I would strongly recommend that after becoming a parent, you do know your personality, you evaluate it. So if you have control tendencies, if you are like this happens with a lot of women who are high performing, high achieving, we want to achieve it all, we want to control a lot, then the kid would be having more tantrums. So that means that the kid doesn't need to be worked on. You need to work on your control issues or your anxieties, right? So does it make sense? Does it answer your query?
Beautiful. Beautiful. Absolutely. And control doesn't mean to suppress, because
Yeah,
sometimes I see super nice families coming to me. Dad is super soft, gentleman. Mom is
yeah,
nice, proper lady. They're saying, Katrina, you're crazy. You're saying baby is mirroring the family. Nobody is angry at our family. Nobody is using such bad words ever. For 10 years we live with my
yeah,
husband. He's the softest man ever. And what we start digging down, we see that guy is
yeah,
suppressing whatever emotions he wanted to say for 10 years. And his
yeah.
baby is nicely showing, instead of that, baby is showing all that hidden anger in this super nice family. So dealing with that,
That's true.
controlling or managing, doesn't mean that you just pretend it does not exist.
That's true. That's true. So the kid will depict all your weaknesses, and that's the basis of basically parenting mindfully. That if you see this journey as your guru, like all, I call my daughter Navya my guru because I think she has taught me the most. When I became a parent, I started seeing parenting from that lens. So kids will always show you what you need to work on. So if you're super good, dude, you need to work on it. You can't be super good. That's not sustainable, right? So you are definitely not being authentic to yourself, and then the kid will show that. So there is a lot that undergoes underneath the evident dynamic of the family that needs to be explored and worked on in such cases. And the parents have to be ready to hear that there is a problem in the family and not the kid. So they have to be ready to shift the lens towards themselves or shift the finger to themselves and work on it.
Great. So several questions came about epilepsy. So,
Yeah,
and we see this happening in a lot of families from smallest
yeah,
children. What could be the reason if epilepsy? I understand that we probably need to do scans of the brain, but if everything
yeah.
comes clear and epilepsy is present,
Hmm.
what
So
kind of
epilepsy,
emotional problem? Mhm.
yeah, yeah. For psychosomatics, we get referrals from almost all the specialty. I'll give you a stats. One third of all the patients who are visiting a journal physician have symptoms that are not explained medically. And a great proportion, some of it would be something that we have not explored yet, but major portion of it is my clients. So major portion of it is psychological distress. right? 1/3 of the patients. So number one, that is the issue, that they are going to various specialties but not to the psychiatrist, or not addressing it psychologically, like due to lack of awareness, due to stigma. So a lot of the patients who are visiting general physicians, 1/3 portion, have medically unexplained symptoms. That's common. Now the most common of such symptom is pain. So
Yes.
like females come with lower abdominal pain, back pain, pelvic pain, vaginal pain, headaches. Pain is a very, very common psychosomatic symptom, and it is usually hiding your emotional distress. And then after that, one of them that is very common neurologically is the epilepsy that you are mentioning, but we call it non-epileptic seizure because it's not epilepsy. So in epilepsy, if we take an EEG, so that will show abnormal waveforms. That is, there is something going wrong in the brain. But in non-epileptic seizures, as we call it, the brain form is completely normal. The brain waves are completely normal. But you are still experiencing those symptoms. So it can be a fainting spell, it can be convulsion, movement of the body, movement of one part of the body. A lot of things can be there that can mimic a seizure. So first of all, we have to rule out, on clinical examination, a lot is clear, you know what is a seizure and what is not. In many cases, we do a 24-hour video EEG. So we keep the client in a room and we see him for 24 hours. And whenever there is a seizure, we see the corresponding EEG and we examine the patient in the seizure itself to establish that it is a non-epileptic seizure. And then the diagnosis is established, then we work on it. So why does it happen? So maybe we can say that there is a computer, and for the computer, your hardware is okay, but it's the software that's at the problem. So if the hardware is okay, there is nothing to be seen on the investigations, on the reports. But if you go by the software, by software, I mean your subconscious, there's something bothering you. So in most cases, when we explore it, it's very commonly seen in women, usually seen after an acute stress or a big emotional event, but it's not a necessity. It can be beyond, without it also. Usually comes in 30s, in the women, in young females also it is seen, in males also it is seen. And when we explore, the most common causes underlying it is depression, anxiety, stress, or some hidden emotion like guilt, anger that needs to be worked and explored on. So sometimes what happens is we deny our emotions. We don't accept them consciously, but our body is very intelligent. It knows how to express it. It knows how to ask for help. So that symptom is basically a cry for help. You're asking for help, just not verbally, but through your whole body. So your subconscious then converts it into a symptom according to your own personality, your own memories, your own interactions with the significant people in your childhood and experiences. And then it gives a symptom that is actually a cry for help. Here, Kat, I also want to mention that it is seen, it is very stigmatizing when somebody is called as non-epileptic seizure. So when patients come to me, they're very, very disappointed that all their reports are clear. So when I say that there is nothing wrong in the brain, doesn't mean the patient is not suffering. He has equal distress, equal suffering. The symptom is real. It's not fake. It's real. They are not making it up. So because of this viewpoint, this belief, sometimes the patients have a lot of anguish, and we work on that anguish initially, and we come to a level of acceptance, and then we work on that. But that's very common. So if you have a non-epileptic seizure, hear me out. That's real. It's really happening to you. You are in distress. You are suffering equally as somebody who doesn't have an epilepsy. And if you take the right help, a psychological help, maybe a psychiatrist, it can be treated.
And the follow-up question, Kapila is asking that if my child has epilepsy, could it be related? How can we tell if that's her own anger, or it's my anger, or it's anger of my husband? So how do we know whom we're going to treat?
Right. So number one, as again, I'll state that epilepsy, if it's epilepsy, that is in the EEG, there are abnormal waveforms, then that is neurological. something is happening wrong in the brain, but epilepsy can be triggered. Those episodes can be triggered by the emotions around. So I will advise then you go for a family evaluation to see the dynamics in the family, and then we can work on. For example, in family therapy, I work with the whole family and we see the abnormal dynamics, and it's so wonderful that by the end, when we reach the end, each member knows exactly what the other member is feeling that they have never done. So the dynamics become
Absolutely.
very, very smooth, very, very normal, and that eases a lot of things. So this is about epilepsy. However, a lot of kids have non-epileptic seizure, and also it's common to have non-epileptic seizures if you're suffering from epilepsy. So you can have real seizures and these non-epileptic seizures too. So in that case, you need both the neurologist and the psychiatrist. Neurologist will take care of the epilepsy part, and the non-epileptic seizures will be taken care of. And it is with psychotherapy that they can be treated. Sometimes medications are needed to treat the underlying depression, anxiety, stress, as I had mentioned, or some other issue. With kids specifically, play therapy is very, very helpful. We do a lot of creative things, drawings, paintings, letting their emotions out. It's very important to understand them and to work on the parents so that the dynamics gets better. So I think I has asked about the kids' epilepsy. So first of all, rule out whether it's epilepsy or non-epilepsy, and then so that both can address the issues there. So maybe he'll need anti-epileptic and psychological help.
Yes, wonderful. And ladies or gentlemen who is watching this, I think this is a wonderful reason to bring also your husband along, because sometimes our spouse might be reluctant to see a psychiatrist. He or she might say, oh guys, yeah, completely fine, what are you talking about? But you can use an example or say like, our kid's behavior is getting only worse. We see that kid was angry when he was 3, now he's taking things. Let's go, we're going to see a doctor for the kid. But I know it sounds a bit manipulative, but it's true. The doctor has to see the whole family, including a father, including a mother, to have a proper assessment. What is the really, what you say, dynamic of the family? Dynamics of the family could be just relationship between parents. That kid is trying to reflect.
Yeah, I'm seminar on YELLFREE parenting. If some of you want to understand your tantrums better, kids, this seminar can help you, in which we'll be handling all the things, your personality and how to go about it. So we'll be discussing in detail that. I think Katrina has mentioned beautifully is that guys or the dads are usually not coming to the therapy. I think there is a lag. Yeah. Can you hear me?
It's okay. Yes, perfectly.
Yeah. So I was saying that you've made a point that the dads have to accompany. So many a times, even in marital therapies, I see that the woman comes, the man doesn't come, because it's about that you are at fault. If you work on yourself, things will be all right. It's not that we can't work on one spouse. We can work on one spouse too, and the marriage starts improving. But obviously, if both the partners are ready to work together, it's the best. So dads and men, you also have mental illnesses, very common. In fact, somatization or psychosomatic symptoms are very common in men. Usually they manifest as breathlessness, that's actually underlying anxiety, or there can be a lot of GI symptoms. So if you have a diagnosis of IBS, irritable bowel syndrome, that's major psychosomatic, happens in males. I had got a few clients who had IBS, and when we started working on them psychologically, we address the depression, anxiety. Men have it, men get bothered. Even after having a baby, men have depression, just like women. So please don't ignore your symptoms. Please don't ignore your emotions. If you have any of the bodily symptom that is not getting cured, you have visited doctors, there is nothing coming in the report, and there is such labels like IBS that are actually psychosomatic, psychological help can help you a lot. It can help you go a long way.
Yes, lots of questions came. What is the difference? Like some members of the family having constipation, some having like fear. Is two different types of people trying to say? Maybe somebody guessing that constipation maybe I'm trying to hold my emotions inside, hold it so tightly that, the whole body is holding tight, while diarrhea, maybe it's something else. So is there such a difference? Can we say based on the symptom what is exactly?
Right.
Is there a difference?
Yeah.
Yeah.
So what you're trying to ask is the symptom pointing specifically to a psychological problem, right? So usually it's
Correct.
not that specific, but yes, when we go psychoanalytically in the therapies, if we go psychoanalytically, we do find a connection. So, for example, constipation, yes, it can be holding on to something. You're holding on to some emotion. It can be that you're holding a lot, but would it always be like that? No, it's not like that. So that's why it's very individual. Your life experiences, your childhood, what emotion did you face somewhere and how it got suppressed. So it depends a lot on your own journey, and that is unique. And when we explore it layer by layer, we find what this unique symptom means to you. It's always communicating something. That symptom is, as I said, a cry for help. It is definitely communicating something, but it is different for different individuals. We can generalize, like, okay, for example, anxiety can be breathlessness, as I said. Depression can be some GI symptoms in the tummy, but it's not always like that. It's not specific. So instead of focusing on, okay, first let me find out what is it specifically, give yourself to the therapist, let him explore layer by layer, what is underlying that particular symptom for you individually.
Yes, I think that's the root cause why people messaging me or sometimes you, maybe they're reluctant to go to actually to see a doctor, and they're trying to have this little therapy through direct messages on Instagram, trying to figure out maybe skin allergy means my irritation. If I stop being irritated and the allergy will go away. Conceptually it is right, but it's easy to say but difficult to do. So how exactly you're going to deal with your emotion if so far it was not successful to that degree that it even came on your skin or your digestion? So guys, don't, it should go to the doctor to, or coach helps. In some light cases we work even with my business clients, we go down to emotions and we start dealing with emotions. It's completely 100% normal. Each human has complexities in their emotions. It's just it's good to use somebody's help to figure it out, right?
Yeah. Also, I would feel that their pain hasn't reached threshold to seek like proper help. The pain has to reach a threshold when they start like really seeking you, because see, without any action there can't be a result. So if you think that you will message somebody and he will say don't think negative, you will start not thinking negatively. That's not possible. That doesn't work like that. So it's not a sudden button, it's not a sudden switch, it's a process, it's a journey that you have to take with any person that you choose to work with. So you have to take that journey, and at the end of the journey you will reach the destination, and in the process you will grow and learn. So all of those who are attending this, please be ready for the journey for that it takes, because it does take effort. I work on myself, cat works on herself. So we all work on ourselves, and that's why, and we are still working. I would say the work isn't complete. We have to keep working every single day.
And what is interesting, when you're actually successful in your work, you get to the next level and a different problem starts there that you cannot even face on your previous level, because you will just break down. But that's the beauty of the journey. And I think in my experience, more successful journey looks like that. Somebody feels that something is not right. They come to program, like for example, my programs, happy program. During this group program, something starts surfacing, and they discover, and that is exploding as some panic attacks, skin irritation, digestion. That's where I'm sending them to Dr. Priyanka or some other psychotherapists, because that is already deep. But that is a beautiful journey, guys. So don't be scared of that, because it's better than waiting until you're 45 and have cancer, God forbid, right? Because it's not going to just go away if you pretend it does not exist. If you're not fully happy, if something is bothering you, that's the journey to start.
And sometimes you may not even know that you are not happy. The body may be telling you. That's the point about psychosomatics. You don't know that you are unhappy or dissatisfied with your job, or dealing with past trauma, even childhood trauma. You don't know. Sometimes the body holds that information and it comes out as symptoms. So listen to your body. Listen to your body. If it is communicating through a symptom, listen to it and address it. So even if you don't feel, you may feel that, oh, everything is fine in my life, everything is good, I'm doing good, but still I have eczema that's not healing, then there is no harm in taking a opinion from a psychiatrist, addressing your psychological issues. We all have it. We all have that baggage from childhood. We all have our own baggages that we need to work on, right? So I think you should be ready for that, even if you
In
don't
your
feel unhappy.
in your experience, like, okay, I think we kind of discussed it, but still people ask specifically hormones. We have
Yeah.
PCOD, we have thyroid gland, and so is there also psychosomatic area that is touching on hormonal imbalance?
Yeah. So hormones, see, let's first try to understand biologically. So hormones is basically through the HPA axis. There is a system from the brain to the endocrine glands below, and basically to our fertility glands. So there's a system in our body, right? That's called as HPA axis. When you're anxiety or even prolonged stress, that axis gets disturbed. So your hormones are communicating with you all the time. They are affecting your mood, and the mood is affecting the hormones. It's a to and fro relationship that it has. So if you are not feeling good, your hormones are definitely going to be disturbed, especially in females, I am saying especially females, because our lives have changed drastically from what it used to be. Now we are working, we are taking care of the house, we have multiple things to balance, and not everybody is able to find that balance. So then it starts showing in your hormones, right? So number one is that biologically, yes, if you have stress, anxiety, depression, any emotion that you're not able to deal with, it will show in your hormonal imbalance. And secondly, I would say that the environment now is not that congenial to hormonal health. There are a lot of toxic chemicals around in your perfume, in your deos, in the cleaning agents that we use, the plastic bottles that we are using. So all of it has xenoestrogens. So the compound, that BPA, it's quite commonly known now. So
Yeah.
they also mess with the hormonal health. So hormones is what controls a lot of things in your body. And again, if it is getting disturbed, the attitude should be, okay, what can I do? How can I address it? It is, again, a lot of things are affecting it. It is your genetics, your own genes that needs to be addressed. Then it's your psychological health that needs to be addressed. And finally, it's your environment or your social health, how you're interacting with people around, and the environment around. So you need to address it holistically. So PCOS was not that common in 1950s. I see my friends who are gynecologists, and they tell me in 1950s it was not that common. After that, gradually it has increased so much that now I hardly find any client who doesn't have PCOS.
Yes.
So
Yeah.
if they
Almost
have
every.
depression, if they have anxiety, very common. Earlier, parents wanted to like stop their fertility. In 1950s, they wanted to stop. Okay, we have so many kids. Now we are not getting pregnant. So fertility issues. So fertility issues is also again hormones. And we get a lot of referrals from gynecologists, especially if there is infertility,
Mhm.
because it needs to be addressed psychologically too. So I would say that every sphere, psychology is, I think, a major cornerstone. It's coming up now. I'm glad that all the specialities are now taking this factor also into account. That's actually affecting a lot of things. So if there is a hormonal imbalance, then you need to address it psychologically. In most cases, there is some psychological issue undergoing.
Yeah.
So, for
Because
example, yeah, continue, Kat.
somebody was just asking, so how to address this imbalance? What are the first steps
Yeah.
if I?
Right. So the first step would be consulting your gynecologist and
Mhm.
seeing what is wrong in your body-wise, get your test done, see the levels. Secondly, I would say have a team. Secondly, have a psychologist or psychiatrist, work with the person who will address you psychologically, address your stress levels, rule out any depression, anxiety, any hidden emotion, your childhood. So when patients come to me, if they are suffering from PCOS and they are taking some medication for it, I ask them to continue the treatment with me and then decide after a while, do they want to continue with the hormones or not, or whatever pills they have got. And in most cases, they are able to be off it, because
Yeah.
stress does a lot of things in our body. It sets the hormones absolutely haywire. So if you're working on your stress, the hormones, they start coming into like regulation. So your sleep is getting disturbed, your food habits, your lifestyle, your emotions, your interactions, your behaviors, all of it cumulatively affects the hormones. So hormones, again, I will say, address your stress levels. In one line, address your stress levels with the psychiatrist, psychologist, I'll say.
Yeah. In the meanwhile, to prevent it, also not to allow
Yeah.
yourself to go into that level of stress that usually is created by a lot of personal sacrifices, sacrificing your rest, your free time, your me time. So that will result in hormonal disbalance several years later.
That's true. That's true, Kat. We are still really behind in the race of mental health. We are still on the secondary prevention where there is a disease and then we
Yeah.
work on it. I am also on Instagram to spread the message that please prevent it. It can be prevented. It's like going to a gym. When you go to the gym, you are preventing physical illnesses, right? Same way, consider this as a mental gym. Choose your coach, work with that person regularly. Don't wait for the illness to develop. Don't wait for your marriage to break. Don't wait for your kid to turn into this rebellious teen. Start working on it earlier itself so that you don't face that issue, right? So basically, you can either I am treating a lot of trauma in adults, grown-ups, childhood trauma, or you can work on yourself so that you don't give that trauma to the kid. So what would you choose? It's a choice. So if you can prevent, why not prevent it?
Yeah. And, I was just speaking to one of my clients yesterday, and very proudly she said, I had a horrible trauma in my childhood, and now I'm strong. I deal with that. I choose not to think about it. So that is not a treatment. Choosing not to think about horrible experience that happened to you, unfortunately, that is not a treatment. So, guys, something else needs to happen here. Okay. A very classical question, classical psychosomatic symptom of excess weight, excessive unwanted weight, and you do everything, you do diet and go to gym, it's not going away. What could it mean? Again, from where to start? What is the right way to even maybe check, is it psychosomatic? So simply my lifestyle is not very healthy.
First, before that, Kat, you were mentioning about trauma. There's a famous author, Dan Siegel, who says that it's very important to make sense of the experiences that you had. So you don't need to deny it. You don't need to suppress it. You need to make a coherent story about it. That's the most important part. So that's what we do in trauma therapy. If you have a childhood trauma, don't suppress it. Work on it. It can be dealt with, and then you'll grow. Okay, coming to this question that you have asked, can you repeat it again?
The question was about unwanted weight. So
unwanted
weight,
weight,
weight is such an issue. Some of us have different kg. Some of us like it, and some of us don't like it. So if somebody really don't like it and trying to get down for some reasons, but she say very unsuccessful, no diet, no gym, nothing works.
True.
Could it be?
So, true. That's again a very common issue, obesity, or not being able to gain weight, basically not having the fitness that you desire to be in. And in most cases, see, with the internet, we all know how to lose weight. There is no big deal about it. We know, eat healthy, exercise, sleep on time, meditate, keep the stress levels low. There is nothing that can be said about it, how to lose weight. But then there is a lot to be said about how to apply it. We all know how to do it. So we know it intellectually, but we are not able to do it. We slip many a times. And that is why you need to work on it psychologically. There can be a lot of reasons psychologically. If you are gaining weight, number first, could be you are protecting yourself. So when I work with my clients who have obesity, and we are specifically working on fitness levels, then we explore them psychologically, psychoanalytically, and we find that they are trying to protect themselves from some emotional trauma, from some emotional distress. It could be something in the childhood. So that needs to be addressed. Secondly, their relationship with the food. So for a lot of us, food is actually mama. when we are scared, we have some big emotional distress, food, oh, I feel nice now, calm and soothed, right? But that's not sustainable. So you are eating food to basically soothe yourself. That could be the reason. In a lot of cases, it is emotional eating. So basically, there is some uncomfortable emotion that you don't want to address, you don't want to accept and deal with it. And instead, what you choose to do is stuff yourself up, stuff that feeling, you're stuffing that feeling down, and that is leading to obesity. Right?
Yeah.
And we need to rule out biological causes of obesity, maybe some hormonal disturbances or some, but that is very less. I would say very less percentage of people have that. Most of us are dealing with emotional issues that is causing obesity. So in my, I have a program for that, fitness mindset, in which I address mindset specifically, not the exercises and the food, little bit on that, but majorly how to have a mindset to lose weight. And to lose weight would be a wrong term, basically to be fit. I don't believe that you need to lose weight to be fit. Weight doesn't matter if you have the right fitness level. So you need to feel fit. You need to feel robust. You need to feel flexible, whatever you want to feel. Maybe for example, for me, my goal is I should be fit enough that I can raise my kids if she chooses to have one someday. I want to run with them at the same speed. So that's my motto. So you have to find your motto. What is that fitness for you? And then you need to work on it. So if you want to work in depth, you can join fitness mindset. Yeah.
Beautiful. And yes, Dr. Priyanka consults remotely. So I think WhatsApp number was shared. If not, connect with her on direct messages. And you know, very interesting, beautifully, you mentioned that food is a mama. So sugar, drinks, alcohol,
milk,
all of these things is mama. And just as, you know, people go to different degree, they completely deny it for themselves. They say, okay, I'm going to punish my, you know, bad body, sit down, still boy. So they try to train your body like a bad dog, right? So denying food and sweets and every other things that compensating your emotions. So instead of that, your body with some extra here and all these other extremes, because this is like, you know, how busy mom is buying your kid a toy because saying I'm too busy, but I'm buying you a toy so you will be happy. That's my way to compensate for that. Should we stop buying toys? No, we should address the root cause of the problem. So saying don't
and
attack your
that's
body.
the reason that when people go on keto and the restrictive diets, they lose weight, but as soon as they stop it, they gain it at a much faster pace. So I will always say do something that is sustainable, that you can see yourself doing all your life, because you want to be fit all your life, not just for an year of keto. So I'm not saying that keto is bad. See what suits you. At least for me, I want to eat holistically. I want to enjoy my meal. Food is happiness for me. So I want to maintain that. But even after maintaining that, you can have a good fitness level. So you need to work on the mindset with specifically with fitness.
Yes. So again, some questions are coming. Do all of us have to go to the doctor right away? See, I think, Priyanka, you will correct me, but I think it depends on your level. Maybe for some people, simple meditation and journaling will start doing the job and doing the trick. For some more difficult cases, they see some side effects of my programs. People say, I lost weight, I get out of diabetes medicine. Yesterday it was a case in my stories. So maybe if you're mild case, but if you're completely, you know, serious case, at that point, you will have to go and see one-on-one trained professional who will help you. In this case, simple journaling, you can journal for 5 years and nothing is going to change. So that depends, in my opinion, it depends on degree of your issue, degree of your emotional trauma.
Yeah, and I would also say, Kat, sometimes you don't know what your degree is. I would say start somewhere, right? At least start. A lot of people are just messaging, they're just reading and not doing anything. I'll say start somewhere. What will happen? Maximum, that person will not suit you. I tell my clients in the first session, if you don't feel the chemistry, don't continue with me. So you can always choose to not continue. That is again taking personal responsibility for your life. But at least take the action. If you feel that this is a problem, but I don't know how severe it is, at least take the opinion.
Yeah.
So when, like in the first session, sometimes when I tell them that you have severe depression, they don't realize that they have been suffering from severe depression since 2 years. They read it, they know the symptoms, but it's very difficult when it's on you to accept that, yes, I am suffering from depression. Because again, the mindsets come, you are a weak person, there's a character flaw. There is no character flaw in having a mental illness or having a symptom. It's just an opportunity for growth. And you can see it that way. And I'll say start from somewhere. There are various sources, there's CAT, there's me. Choose wherever you want to start, but at least start somewhere.
Yes, I think it's also a matter of convenience. People think that, oh my gosh, I have to, travel somewhere alone without my husband. I have to take a cab and go to some psychiatric hospital to see some doctor. Oh my gosh, it's not so difficult nowadays. You can get consultations on WhatsApp. Again, we're going to share Priyanka's number. It's like you can do it all in convenience and comfort and security and safety of own house. Many of my clients speak to me at 6 o'clock in the morning because they don't want their family to know. But so you don't have to expose yourself. I think that is the main issue. It's not like they don't want to get treatment. They think it's super expensive. And secondly, they think it's super inconvenient and my whole family will know. So it doesn't have to be this way. It's actually very accessible these days.
Yeah. As I said, that take the first step. If it doesn't suit your bill, there are a lot of options. Choose it. Choose something from the bouquet and have that. So I have clients consulting from the washrooms. I have clients consulting from the washroom of their office, cars. So I like to work at their convenience, like what will suit their bill, because obviously they have to be ready to help themselves. So we have to make it comfortable for them. So choose somebody who I can understand when you say that going to a doctor's clinic. I specifically don't work like that. My relationship with the clients is very personal, very individual, and I'm almost like a coach, a guide, a friend. So you have to choose that. So if you go to some psychiatrist and if you don't feel that connection, if it's very dry for you, then change it, I would say. Or if you go to a coach and if you don't like it, change it. It's again your choice. There are a lot of options available. But at least start and try somewhere. It's convenient. It's on WhatsApp now. It's online now, so you can consult from anywhere with anybody. So at least take that step and at least start inquiring.
Beautiful. And actually, I have a case study of one of my clients who brought her husband to Dr. Priyanka to discuss this marriage situation online, I believe. And they had some wonderful results online through WhatsApp or through online consultation. So even if your husband is so much against of seeing some doctors in the clinics, he can just join a little half an hour call. That is not a very scary thing.
Right. Okay. And we are trained to motivate also. Like it's not that everybody is motivated when they come. That we are trained to increase. Motivation can be enhanced through therapies. So if the client is not ready or the husband is not ready, we are trained for that. So that's why I want that you give a chance to the person who's specializing in it, because obviously that thing, they face these issues a lot. So ask questions, queries, and I think it can be helped with.
Yes. So several questions came during our live sessions. My symptom. Kidney, yes, it's usually anger. Skin irritation, skin allergy. It's irritation of you. It's annoyance and frustration with some issue that you don't want to face. There is a classical things you can guys Google. There is some wonderful books. I think Louisa Hay and Liz Bourbeau, wonderful books. But again, most likely, in my experience, you're going to buy a book, you're going to read a book, you're going to diagnose yourself that you have some issue that you don't face. But then what? What is the next step? All of us know that something needs to be done, but it's important to take the step and actually do it, because it's not going to heal itself just by reading some book, unfortunately.
That's true. It goes in the blind spot. Basically, you feel you know, because you've read it, I know it all, but it's not helping you. So that's the biggest problem, I think, of this century, that because of the information, we know it all, but how to implement it in our lives, and we don't implement it. So we feel, oh, we know it, we are doing it, but you're not doing it.
Yeah, we are not doing this. I don't know why people, spend money on lipsticks and t-shirts, but they're scared to spend money on a psychotherapist. And what you mentioned right now, I'm suffering a lot from the gratitude journal. I'm giving it to all my clients, and I say, yes, Katrina, I know gratitude journal. I know it's such a usual thing. And so, yes, so do you do it? Do you do a gratitude every? No.
Yeah.
So it's not enough to just hear about gratitude journal. You really have to do it every day. Then it's going to work.
Yeah, and that's what the work of the therapist is. That's what, like, they don't do it, and then it's my job how to start that motivation also to write it. So this is also a common block that we face. 70% of my clients are not able to do the homeworks that I give. But then that's what we specialize in, how to work around it, around your weaknesses, how to work around it. So that can be worked on. But yes, by reading books, it will not help. You need to take help. And I believe in this century, if you want to invest in something, invest in your personal growth. Then you can do anything.
Yes.
So invest in your personal development with any person.
Luckily, I see that things are changing. I think first step was people start investing into fitness trainers. Yay! Now they invest into dietologists and nutritionists. Great. So I think next step is a psychotherapists. So just as you hire some guy to put you to therapy, some mental exercises, probably more important than size of your biceps. Anything else, Priyanka? Anything else that I'm missing based on your experience with somatics?
One thing I think I would like to mention again, that your symptoms are no less real. Even if there was all the reports, all the investigations are okay, doctors are saying that, okay, nothing, I can't find anything wrong in your body. Please don't take it to your heart that I'm faking it, I'm making it up. And people around also, they start saying like, oh, there is a term for non-epileptic seizures that I hate. It's pseudo seizure, that people call, even in medical fraternity, we call it pseudo seizure. And I hate it because it's not pseudo, it's as real as a real seizure. So if you have any symptom, you have been going to multiple doctors, but you are not able to find the reason, please take psychological help. It will really help you. It will help you understand yourself much better. And as Kat and me discussed, that even before it develops, work on yourself. Choose something. There are a lot of things that you can work on. I have programs, Kat has programs, we take individual sessions. You just start somewhere, or somebody else, some third person. You can choose wherever you want to work on yourself, so that these don't develop. And your body is always talking to you. Please listen to it. Don't ignore its voice. Body is speaking to you in a lot of ways. Don't ignore it. Work on it.
Wonderful. Beautiful question came from Nilam. She's saying, she's asking, what is the best thing we can do as parents to avoid any childhood trauma for our kids? So it's a very long question, but
very long myself, and just 5 minutes left.
if I allow myself just a very small hack in my experience, my answer to this would be: trust your heart, live your life according to your heart. Seriously, do not suppress your own heart and your own desire. Do not work on the jobs that you hate. Do not live with people you don't like. Do not silence yourself when you want to speak up. So that will help your kid, because whatever you are suppressing for the sake of maybe money, maybe social, maybe appropriateness, that is going to go directly onto your kid to suffer, because it's either you're going to explode at some point, creating that trauma moment, or it's just going to go for deeper channels. What do you think, Priyanka?
I would also like to add, Kat, that you can't 100% prevent a trauma, because we are imperfect. We are human beings. So even if we do everything right, we can't do it always. Still, the kid will have a little bit of his own journey that he needs to work on as he grows. That's a part of growing up. You need to make a coherent story, as I had said before. But yes, you can prevent a lot of trauma if you choose to work on yourself. You should know yourself as a person, find your authenticity. And as Kat said, then act according to that. You need to know yourself. You need to address your childhood issues. That is, I would say, reparenting yourself is one word answer to that. Please reparent yourself. I strongly believe that before you choose to become a mom or dad, please work on yourself psychologically. Reparent yourself. I
Yes,
want to do a program on that. Like,
I
first,
wish
this
we
is very
could give
important.
driving license. I wish
Yeah,
like we
like that.
give
Yeah.
driving licenses. We should
I
give
wish that
license to
like you should be
parents.
ready. Yeah. We see we are physically ready, but we never see like how are you ready mentally? Because kids challenge you in ways that you can't imagine. You can't prepare for it. I was 100% prepared, but even I was flabbergasted. Even after being a psychiatrist, I was flabbergasted. And when I opened my eyes to this journey, I started growing. I have changed so much in the last 4 years. I have grown a lot. Last 4 years have been, my daughter is 4 year old. So that have been, I think, the immense growth years for me because I took parenting as a therapy. So I see this parenting journey as a therapy. It points out my things that I need to work on, my childhood. And when I work on it, I read, I attend my seminars, and I have changed, I have grown. So I would say that one thing that you can do for your kid is raise yourself. Not the
Yes.
kid, he will get raised on his own. Raise yourself. Choose a coach, choose a mentor, and work with him or her.
Yes. It's a wonderful psychological joke between psychologists saying that no matter how hard we are all trying here, your
Yeah.
kid will still have something to complain to their psychotherapist when they grow up. So
Yeah,
no
true.
matter how hard we work here right now, even in this question itself, I see a little bit flavor of sacrifice. What should
Yeah.
I do? What should I change to make
Completely
my
protect
kids'
them.
life
Yeah.
better? Well,
Yeah.
it doesn't matter. It's okay. He chose you as a mom. For some reason,
Yeah.
this kid soul chosen you as a parent, so they know what they got into. They know
Yeah.
what's the deal. So you just be
Also, I
true to
can see
yourself.
lack of self-compassion here. The person who has a Neelam, you need to work on self-compassion there. You can't be perfect. It's just not possible. You have to accept your flaws, right?
Yes,
That will come along with.
but wonderful question. Yes, from there
Yeah.
we can go down to you parenting yourself also. Maybe first, maybe even before you
Yeah.
do something for your kid, you do something great and amazing for yourself, for your own
Yeah.
soul, for your heart.
Yeah. Right.
Great. So interesting, guys. Started from allergy, skin allergy, and constipation. We got still down to the most deepest issues. Like it's.
I think we need to hold 2, 3 more to address all the queries that we have received. There are so many queries can't be answered in one
Yes,
life.
but I think we can just generalize just a little bit. No, your symptom. Using just some table or some kind of book may not point you directly to that exact reason, and definitely it
Yeah.
will be extremely difficult for you to work on this alone without any professional help, because if you didn't fix it before, what makes you think that by doing meditation alone you will fix it? So no,
Yeah.
we can talk about different correlations here, but the answer is still the same. If it's seriously bothering you, if your body is desperately trying to show you that something is not okay here, as a back pain, as a vomiting, as a anger, anything that comes to you
Yeah.
unexplainably, then time to go, time to do something. Go to WhatsApp, don't go anywhere. Just find Priyanka. I think now you can follow Priyanka, and I will share again all the contact information in my stories. And thank you very much for a great
Thank you
session.
for inviting me, Kat. I had a wonderful time. I had a
Thank
wonderful
you,
time
guys.
discussing this. Yeah.
I'm going to save the session. Who joined just now, you can see it on my IGTV, and more to come.
And if they have queries, they can DM me. More queries, we can plan something in the future. If they have
Absolutely.
more queries. Yeah. Okay.